Dr. Sen, you are a leading researcher in the field. What is the latest research news that you can share with us about small cell lung cancer?
There's a lot of great research going on in my lab, in labs all across the world. I think for the first time in a very long time, we are really trying to dissect the biology of small cell. It has been a research in making for many years, and I think we have now really come to a point where we are really trying to understand the disease. And I'll go a little more about the questions that we are trying to answer. So one of the main questions, or one of the main things that kind of is a hurdle to getting durable treatment options, is that the frontline chemotherapy and immunotherapy doesn't work as well as they should. Even for the approved regimens, which is the chemotherapy and immunotherapy, the patients often do not have durable benefit. And even if patients have durable benefit, it's only in a very minority of patient population, which means in only about 10 to 15% of the total patient population actually do have any benefit from the frontline treatment. So the main question that we are trying to answer is that why do these patients not respond to immunotherapy and chemotherapy in the frontline? What are the mechanisms of resistance to chemotherapy and immunotherapy? Primary resistance, and what I mean by primary resistance is that patients who never respond, like from the disease comes back even while they're getting the frontline chemo. So the primary resistance, what are the mechanisms? And of course, when they have acquired resistance after the maintenance regimen, when they come back, why are these patients having this acquired resistance to chemotherapy and immunotherapy? Because only when we understand resistant mechanisms will be able to then come to the combination strategy. So that's the next area of research, is that once we understand the mechanism of chemotherapy or immunotherapy resistance, is then coming up with effective combination therapy. So what should we combine with immunotherapy in order to make immunotherapy better? And I'll give you an example from the research that we did. So our lab focuses, as I said, on making immunotherapy better. And what we understood is that there are certain epigenetic modifiers like LSD1. Repressing LSD1 with a small molecule inhibitor actually augments or benefits the response to immunotherapy. So now we are looking at LSD1 inhibitor in combination with immunotherapy. That's one area that we are focusing on. The second area that we published extensively on is DNA damage response inhibitors, which really works in combination with immunotherapy and makes immunotherapy response better. So now we are investigating that in the lab, the combination strategies of combining these DNA damage response inhibitors with immunotherapy. So combination strategies. And I think, always coming up with novel targets. And I will mention there are many novel targets that are right now in the clinical trials and actually showing really, really encouraging data. And I'm talking about DLL3 targeted BiTEs or ADCs that we have seen that are showing preliminary data. We have seen really good response in patients. So, finding these targets that are very specific for small cell and that could work in these unique population of patients. So DLL3 targeted agents, there are agents that target B7H3. So we are looking at these novel targets and where they could fit in the current therapeutic regimen. And finally, since small cell lung cancer is not a surgical disease, we have to look for other options to find biomarkers. So liquid biopsy, what I mean by that is understanding the disease not just from tissue, but also from blood. And there's a lot of research that's happening in understanding the biology of small cell from blood draws from these patients. So the field of using liquid biopsy or understanding the disease from blood draws is one of the areas that many labs, including ours, are focusing on, and how we can utilize these blood samples to then monitor the disease and also understand the resistance mechanisms to various drugs. I think these are the areas that we are investigating, and to me seems like very important areas that we need to address in order to really manage small cell lung cancer.
Mm-hmm. What do these advances mean for small cell lung cancer patients? Are you hopeful?
Oh, yes, of course. We're always hopeful. I mean, that's the goal, right? The goal is to have effective therapies that works and that works for a long time, and that also benefits the patients in terms of quality of life, which means without very severe adverse effects. So very hopeful because I think what was limiting us all these years for the last 40, 50 years is that we really did not understand the complexity of small cell lung cancer. It is a very complex disease, and it is very different from non-small cell lung cancer, which has these mutations that you can target drugs against. So there are these EGFR mutations and KRAS mutations in non-small cell, but small cell, it's not that. It is not a disease where we have these gain of function mutations that we can devise therapies against. It's a very different disease. The disease is aggressive, the disease progresses fast, and it also changes its physiology very fast. So I think for the first time, we really are trying to understand the biology, and what that helps is then to come with very informed decisions about therapy. So yeah, I'm very hopeful because I think we have now targets that we are actually seeing benefits in patients. And I think the more and more we understand the resistance mechanism, we'll also be able to manage that better.
Yeah, that's very promising news.